Hello, and welcome to one of our 11 Together to Goal Plank Mentor webcast. Today we'll be hearing from Dr. Scott Hines of Crystal Run Healthcare. Dr. Hines is the Plank Mentor for the Embed Point of Care Tools Campaign Plank. Dr. Hines, thank you so much for joining us today.
Oh, it's my pleasure. Thank you for having me.
Great, so let's get started. Why don't you tell us a little bit about you and your organization?
Sure. So Crystal Run Healthcare is a physician-owned, physician-led multi-specialty group. We're located in the lower Hudson Valley of New York State. We have approximately 450 providers spread out among 20 different office sites in Sullivan County, Orange County, and Rockland County. And I am an endocrinologist. I've been with Crystal Run since 2006, and I'm also their Chief Quality Officer.
Great. So tell us a little bit about what point of care tools you use to help manage your diabetes patient population.
Sure. So a couple of years ago, we worked closely with our internal business intelligence team to build automated gaps in care sheets for all of the visits that our providers are seeing that day. And these gaps in care sheets have many different tools on them, but one of the tools is to identify what services or gaps in care the patient has based on their demographics and chronic conditions. So for example, if you were a 60-year-old woman who has diabetes, that gap in care sheet would show when you last had and when you're next due for all the different diabetes measures, cancer screens like breast cancer and cervical cancer, immunizations, et cetera. We decided to focus on diabetes on this as well because there are so many recommendations that are currently adopted by the American Diabetes Association around eye exams, kidney screening for kidney disease, foot exams, A1C testing, et cetera. And so all of those are on these gaps in care sheets. And our medical assistants use these gaps in care sheets initially when they room the patient. And so if there is a gap, so for example, if they notice that a patient is due for a urine test to screen for kidney damage from diabetes, they'll go ahead and tee up that order for the provider. So when the provider comes in, if they agree that the patient should have that study that day, they could easily order that study. So these gaps in care sheets have made it much easier on our medical assistants by doing away with the manual chart prepping for the visit, and also has made it very easy for our providers so that they can see in one glance what are the studies that the patient really should be having that day.
Great. So how did your organization determine what point of care tools to utilize and how to implement them?
Sure. So we have a committee called our Practice Redesign Committee, which is constituted by all of our primary care medical home leads. And one of the charges of this committee was to come up with a way to make it easier to both make it easier and also standardize how we're rooming patients, and also how we're going to identify services that patient needs during that visit. And so we actually tried using a vendor to do this, and we found that they just were not able to meet our needs. And so we're lucky enough to have our internal business intelligence team. So we built this kind of from the ground up with the on the advice from our Practice Redesign Committee, as well as myself and a couple of the other physicians.
Great. So how does your organization address the issue of alert fatigue?
Sure. So one of the reasons why we decided to go with these gaps in care sheets, which are actual pieces of paper that are given to the that are printed out at the beginning of the day by the nursing staff, by the medical assistants, given to the provider, is because we did not want to use pop-ups. We have tried pop-ups in various ways previously, and what we find is that it just annoys our providers, it slows down their workflow, and many times they just kind of X out of it, and you're not getting the attention to what that is trying to get you to pay attention to. And so we decided right away that we did not want to use any pop-ups, and so we created these sheets and really, again, early on, engaged our medical home leads to identify what would be useful for them to have on these sheets. So we felt like if we were providing our docs with the data that they are asking for and looking for anyway, that it would really be useful for them and they would use it. And, frankly, we also tell our docs, they have a choice of whether they want to use these or not. But I would say in primary care and in endocrinology, over 90% of our providers use these. And I think part of the reason for that is because diabetes is so overwhelming with the number of recommendations that this is a way to really localize it all in one place and make it easy for folks to use it.
Wonderful. So our last question here for you today is, how would you say that point of care tools have impacted the care you provide to patients with diabetes?
Sure. So if you look at our performance on the various diabetes measures, whether it be diabetic eye screening, urine testing to screen for kidney damage, A1C testing, et cetera, you'll see a steady improvement over the period of time that we've instituted these sheets and instituted this point in care tool. Again, I don't want to attribute it all to that because we've done a lot of other things. We really approached this in a multifaceted way because we made the treatment of our diabetes population a top priority for our quality improvement campaigns in the last couple of years. Much of that tied to AMGA's Together to Goal. But we do believe that these point in care sheets have made it easier for our, again, nursing staff and our providers to identify what gaps in care a patient has at the point of care when they're a captured audience, so we can make sure that they get all the services that they need that day. And I think that that's helped in our improvement in our performance over the past couple of years.
Well, Dr. Hines, thank you so much for being here today and sharing all these wonderful insights. This has been very informational for our Together to Goal campaign participants. And just as a reminder to fellow participants, if you'd like to contact Dr. Hines to discuss implementation of the Embed Point of Care Tools campaign plank at your organization, please email t2gmentor@amga.org. Check out our remaining Together to Goal Plank Mentor webcasts on our website to discover what other experts have done to improve diabetes care across the country.